Thank you for joining Texting Your Patients What, When, and Why. Texting has become such a normal means of communication for us these days. Literally, just about everyone in the U.S. is sending and receiving text messages. We're a busy culture, and texting is fast and convenient. So today, we'll talk about how to use text messaging to reach out to your patients. In today's presentation, we will discuss the demand for text among U.S. consumers, how this technology can play a role in your provider-patient communication, the optimal time to deliver text messaging to patients, and the must-haves and tips for getting started. So I'd like to share with you first some statistics. 91% of U.S. households are mobile subscribers, which is interesting because it matches up exactly with the survey that we conducted with patients that I'll tell you about in a moment. Also, 72% of adults are text messaging regularly. 25% of U.S. households have abandoned their landlines completely and only use their mobile phones. There's an 80% year-over-year growth in text use per subscriber. So if you're sending 100 text messages a month now, a year from now you're likely to send 180. Also, there's 1.9 trillion text messages that were sent in 2009, and it's projected to be in the 6 trillion by the year 2014. Which brings us to the big question. Does this demand for text also apply to the healthcare setting? Well, let me tell you about the survey we conducted. We surveyed patients at a multi-specialty clinic across a variety of departments where the ages were anywhere between 16 and 92. We wanted to make sure that we had an appropriate cross-section of the population. 38% of the people surveyed were ages 40 or over, so you see we hit young and older patients alike. And this is what we found. Patients of all ages are using text messages on their phones. 91% of the respondents use it. That's that 91% that we told you about earlier, that 91% of the population is using our mobile subscribers. Well, 91% are also using text messages on their phone. So as you expected, on the left side, you see the younger patients that are all using text messaging quite a bit. But what you may not have expected was on the right, you see the 50 and older group. More than 60% of them are also using text messaging. So we asked patients, what type of automated appointment confirmations are patients most likely to respond to? When considering options for appointment confirmations, it's clear that text messaging was the preferred method which they chose to confirm an appointment. So the chart on the left is a percentage of all responses, where the one on the right is just a subset, which is actually the 91% majority, who did use text messaging. Notice it nearly doubles phone calls for the preferred method for appointment confirmations. We also asked, what type of messages would you like to receive to remind you of upcoming appointments? The preferred method again, text messages. As you can see, it doubles the second place method, automated phone calls. And the least preferred was live calls from staff, which is a method that I'm sure that most practices still have in effect today. Our texters were also asked what other types of communications would be helpful to receive via text. Besides appointment reminders, they wanted to receive payment reminders, tips about health conditions they currently have, preventative health tips like reminders of immunizations, and finally, patient satisfaction surveys. Think about it. What a convenient way to reach out to your patients and say, how did we do? Texting is a powerful way to stay in touch with your patients through the patient life cycle. So let's take a look at some of the applications that you would use for text messaging. So the image you see on the right is just a representation of texting through the patient life cycle, from the moment they have an appointment with your practice, after their visit, and ongoing communication that may get them to interact with your practice once again. We've talked a lot about appointment confirmations. One benefit of a text message versus a phone call is that unlike a phone call, the text message can be stored for future reference. Until the user deletes it, there's always that record of exchanged communication that they can quickly just view by looking at their text messages. So if they're wondering, like, when is my appointment again, they can easily go back and see, and there's no need to have it written down with a pen or paper, or if they didn't get the call, they don't have to go back and listen to a voicemail. It's very convenient. And notice, we didn't just say appointment reminder, we said appointment confirmation. That's because one valuable piece to this is the ability to collect a response. A simple yes or no lets you know if the patient is going to come in or not. And the cancellation is just as valuable as a confirmation. If someone responds with a no, now you have an opportunity to follow up with them and make sure that you get them on the schedule at another time. And also you're aware that you have an opening where you can book another patient who's been maybe waiting to get in. So here's an example of a text appointment confirmation and how that would work. A message goes out that says you have an appointment tomorrow at 3 p.m. To confirm, text yes. To decline, text no. The patient can simply reply yes to the message. Then they'll receive an acknowledgement. The acknowledgement is common to many text messaging programs. Basically, it lets the end user know that in fact their confirmation or their response did go through. And it's also an opportunity for you to thank them or add any additional instructions, like make sure to bring your insurance card, copays are due at the time of appointment, and so on. Another useful application is the post-visit survey. These can be sent out at the end of each day to survey all of the patients you've seen, and it can be simple. Think yes or no type questions. I'm going to do slide 12 again. Another useful application is the post-visit survey. These can be sent out at the end of each day to survey the patients you've seen. The surveys can be simple. Think yes or no type questions. Did you feel you received quality care today? Was your wait time reasonable? Did our staff or facilities meet your expectations? It really depends on what you're trying to monitor in your practice. Here's an example of a post-visit survey text. Central Healthcare sends out a text that says, "Thank you for visiting Central Healthcare. Were you satisfied with your appointment today? Reply yes or no." Imagine someone replies no. You'll probably want to reach out to them and understand what happened, what may have caused a negative experience. Again, it's really seizing an opportunity to connect with your patients and improve things in your practice. Another application for text messaging is account alerts. Reaching out to your patients early and letting them know of a balance due. It alleviates efforts on your end to make sure you're getting payments in. So you can use these as a reminder, just simply to let them know that a statement has been sent, or if you need to send more urgent messages if an account is overdue and may be close to going to collections. It's another way to use text messaging. You may even want to include a phone number or a URL so they can make online payments. Take a look at this collections messaging timeline. We like to recommend text messaging as a way to reach out to what we refer to sometimes as lazy payers. And these are people that intend to make a payment. They may just procrastinate. They let their mail pile up for a long time, and they just haven't taken the time to sort through and pay their bills. So in the 0 to 90 days after insurance is submitted, a statement goes out, and that's the recommended time to reach out to these patients. It's a great way to prod them along and get them to take action and make a payment. And since it's automated, you can focus your person interaction and having your staff call in to the people that have more urgent accounts, maybe something that's due to go to collections. This is an example of what a payment balance notification may look like. The message here indicates an amount due and simply provides a phone number or a URL should they be able to make an online payment. And finally, text messaging can be very useful to promote preventative care, whether it's to encourage annual visits, send immunization reminders, or perhaps there are seasonal programs such as sports physical or it's flu season and you want to let them know that you have flu vaccines in your office. It's a great way to proactively reach out to your patients and grow revenue by reminding them of services that are available to them outside of sick visits. Think about it. If you generate just one appointment from a campaign for elective or preventative care, you've well covered the cost of that campaign with one appointment. Even a 1% response rate would deliver a positive ROI. The sample you see here is just a reminder that it's time for a yearly checkup. notice one thing: this message isn't asking for a response at all. And this is just to illustrate that a text campaign doesn't always have to be two-way and require a response. You can encourage other actions, like to make a phone call. I like to look at preventative care text messages as a way to promote overall health and keep the patient life cycle in check. And it's also a way, again, to generate revenue in your office. So you might wonder, when or how often should you text? Well, first of all, let me say, to truly engage with your patients, we recommend a multi-channel approach. By multi-channel, we mean email, phone calls, and text messaging. After all, you can't really predict what people are going to respond to and what type of message best resonates with the end user. So a multi-channel approach ensures a connection. So here's an example of a strategy for an appointment confirmation. So you can see 2 weeks prior to the appointment, we're sending an email, so patients can add that appointment to their electronic calendar. 3 days out is a good time to obtain a confirmation by sending a text message. 2 days out, you may want to connect with the patients that may have not responded to the text message and remind them of their appointment again and try to get a confirmation that way. And then even up to 2 to 3 hours out, you can send another text message. After all, people are busy. They may be out running errands or doing other things before their appointment. So it's just a good way to keep them on track, just to have that last minute reminder go out. Now, with something like surveys, the time frame will be much different. You're not leading up to an event necessarily. You may want to send this out as soon as possible after an appointment while it's fresh on the patient's mind. And then with patient balance notifications, we discussed this earlier, reaching out in this early phase of delinquency. Texting in this time frame can help alleviate the efforts required for collecting on troublesome accounts. So there's a couple of important things you need to know before kicking off a text message program in your practice. First of all, you have to have the patient's cell phone number in your scheduling software. I mean, it makes sense. In order for them to receive any kind of communication to their cell phone, you have to have the number on file. But the second important piece is the patient has to opt in. So in the case of most text messaging programs, there's typically a word that you will text to a particular number. In the case of TeleVox Smart Text, you'll have a custom ID or a keyword associated with your practice that you choose that they'll simply have to enter and send to this 622-622 number. And even though that's a step required on behalf of the patient, it's important that that's there because essentially it protects the end user and it lets them know that they're not going to receive spam, that this is legitimately interactions on behalf of your practice where you will be sending them text messaging. And again, it's not uncommon, it's typical among all text messaging programs that the end user does have to opt in. Since a text messaging program does require interaction on behalf of your patients, there's some things that you can do to increase the adoption among patients. First of all is staff and patient conversations, simply letting them know at check-in and check-out that they can receive their appointment reminders via text message and how to opt into that service. Also, to make sure you have your sign-in sheets updated in a way that you're collecting their cell phone numbers, so when they opt in, the system knows which patient to associate the number to. If you're using automated phone calls for appointment reminders or other services, or even on your own hold message, you can make sure to add it to your script. You can utilize counter cards and signage in your office to remind patients of the convenient service, whether it's direct mail, statements you send out, making sure you have it in emails on your website, just making sure that you seize the opportunity to let them know that the text messaging service is available and instructions on how they can enroll. If you would like to learn more about texting your patients, you can definitely contact us at 1-800-644-4266 or email learnmore@televox.com. If you're a TeleVox House Calls customer, make sure that you have your customer number ready. Therefore, we can help you in the most convenient way possible.